Auzubillahi minash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Now I am here again with the new video, and before starting the video I want to tell the format by which I am making these videos. Uh, as a textbook of ophthalmology or any clinical book of ophthalmology, it starts usually from eyelids and then conjunctiva, cornea, from forward to posterior until it reaches to the retina, which is in Urdu called Parda Bisarat. So the public service videos which I am making, they are accordingly, and I am trying to make the videos according to the sequence of the structures of the eye, so that it becomes a type of you can say a curriculum or syllabus type of thing, by which in a sequence you can find out at which structure of the eye we are and what are the diseases in that structure in common man's language. As far as medical students are concerned, we also teach them from right from the eyelids to the last part of the eye, the retina, and in clinics and in lectures, in that sequence we learn. And whenever I find the opportunity during the clinical examination which the students are being taught, I try my level best to make the video of that and upload it for later use and review. Now I come to today's videos. As we talked in the last video about herpes zoster infection, which is which happens at the one side of the face and may involve the eye and cause the blindness. Today I will talk about the allergies of the eye, which are also from the anterior part of the eye, which is called anterior segment. Usually the patient comes to us and says himself that give me some medicine of allergy of the eye, and he has already made a mind that he has got allergy because he feels itching. That's right, right to an extent, because most of the causes of allergy, the main symptom is itching, but not each and every case. For example, if a patient has got dry eyes, that is the tear film is decreased, then he may also present as allergy. So leave the diagnosis to the doctor. Just tell him your symptoms and let him examine you on the special machines and relate them with your symptoms, and let your doctor, eye specialist, make the diagnosis. There are many types of allergies in the eye, and the one common type is simple allergic conjunctivitis. Conjunctiva is a part of the eye which is present in front of the white structure sclera of the eye. When it is attacked by something, its response can be developing an infection or developing some sort of inflammation which causes inflammatory mediators, which causes the sensation of itchy eyes. So patient is forced to do the itching. For that, we simply advise the antihistamine eye drops, or in long-standing cases, we also prescribe the mast cell stabilizer so that the histamine is not secreted from the eye. The most important and sometimes real threatening disease is called vernal keratoconjunctivitis, or VKC in medical language. It usually happens in children, especially in boys between the age of 5 and sometime it takes it ends at the age of 25 years. It is of three types, and the child comes with the inflamed eyes, and it is a specific type of allergy, and it is a specific entity which is written in the book, and there is no special cause, but there are some factors which aggravate them. Especially they occur between the season of August to March. That is when it is there are increased number of flowers, and especially the pollens from which the flowers are developed. So basically they are predominantly caused by increase in the pollen, and as we know, most of you people must be knowing that pollen cause many other related allergic reactions like asthma and other skin problems like urticaria. In eyes, it may cause vernal keratoconjunctivitis, in which the conjunctiva is involved for a long period of time, and the cause is the antigen, which is antigen and hypersensitivity reaction 1, IgE, is the antigen against which the body forms the antibodies. So this is a long standing disease. It has to be treated very meticulously, because if untreated it may involve the cornea and cause the opacification of the cornea and permanent distortion in the visual acuity or the vision in general. The patient's both eyes become involved, sometimes only one part of the conjunctiva, sometimes all the three parts, and there are red eyes, itchy eyes, watery eyes, and patient is in severe discomfort. You must go to the eye specialist and tell him the symptoms. The patient is usually less than 25 years of age, and the eye specialist would probably prescribe you accordingly with antihistamines, mast cell stabilizers, and in severe cases steroids administration from different routes, which can be eye drops or which can be injections in the eyes in severe cases, and it is not that dangerous, but if treated properly it totally resolves, and after 25 years or sometimes 20 years it disappears automatically. But before that you have to prevent the damage which it may cause, which may be irreversible, and may impact the rest of the life of the patient. So I will stop here today's video. Please let me know what you people think. What should I talk about about the eye problems. What are the questions in your mind? And the medical students, please let me know what lectures do you want me to discuss, or if you want me to share the PowerPoint presentations of lectures, let me know, or any other questions, suggestions, or anything like that. And lastly, again, if the music lovers want to listen some specific song or some instrument, they want some information, they may also post in the comment box. Here I will finish, and I hope to meet you people again in the coming days soon. Inshallah. Khuda Hafiz.